Well, good morning. We're here today on the territory of the signatories of Treaty 7, and I recognize the Métis people of Alberta who share a deep connection with this land. Behind me today is the Alberta Children's Hospital, where we've all seen the images of children and families queued up outside the emergency room door just to get a seat in the waiting room. And today I'm sharing AHS data from the last 2 years, which proves just how bad the situation is right now. Not just here at Alberta's Children's Hospital, but at all 5 Calgary area hospitals. At every hospital, Albertans are waiting longer to see an emergency doctor under the UCP. AHS reports what percentage of patients arrive, see a doctor, and get discharged within 4 hours. In December of 2020, 80% of patients who went to the Alberta Children's Hospital would be discharged within 4 hours. As of today, that is only the case for 40% of patients. Half as many patients are able to get in and out of the emergency department within 4 hours. AHS also reports similar trends at every hospital in Calgary. At Foothills, the Peter Lougheed Centre, the Rocky View General Hospital, the South Health Campus, and here at the Alberta Children's Hospital, which has seen the most significant drop out of all of the hospitals. Just imagine the anxiety of a parent and their child, sick enough to go to the emergency room, queued up outside the doors with hours more waiting ahead. This is another symptom of a healthcare system that is under incredible strain. And we can see that strain right across Alberta. 20 communities across the province have fully or partially closed hospitals. The Milk River Emergency Department was forced to close overnight because there was no doctor available to staff the hospital. The Wabasca Damaris Emergency Department is closed as of Tuesday until Friday. These closures put more pressure on surrounding communities and cities. The healthcare crisis in Red Deer specifically is putting more pressure on Calgary. The UCP's mismanagement of healthcare has led to surgeries in Red Deer to be diverted to other communities, such as Calgary. And only a few days ago, the Rocky View Hospital had to cancel 24 surgeries only hours after Jason Kenney staged a presser in front of unstaffed beds pushed into an unfinished space. Overwhelmed hospitals put pressure on our ambulance system. And last week we shared data showing response times for ambulances have gotten far worse under the UCP. Indeed, across the province, the slowest 10% of calls for an ambulance have gone from 12 minutes or more for an ambulance to be dispatched to 17 minutes or more. 12 minutes is outside the target time for ambulances to be dispatched, and now the slowest 10% of calls are taking 42% longer or more. That's an extra 5 minutes of waiting for a life-threatening call, and that could have tragic results. Part of the pressure on our ambulance and hospital system is driven by the UCP's war on family doctors. Doctors are leaving the province at record rates, yet the UCP still continue their combative relationship with them, driving even more out of province. Over 40,000 people in Lethbridge do not have a family doctor. There are no doctors accepting patients in Banff and Canmore. In fact, under the UCP's time in office, the number of doctors across the province accepting new patients has been cut in half. Without a family doctor, families have nowhere to go but the emergency room. This is not okay. The UCP has thrown healthcare into chaos. Healthcare workers have been completely abandoned by their government. Patient care has been neglected, and enough is enough. We have a healthcare system in crisis and a health minister in denial. And we cannot afford to allow the UCP to deny this crisis any longer. Albertans can simply not trust the UCP with their health care. If we want to have a better health care system in Alberta, it's clear we need a new government. Unlike the UCP, an NDP government would strengthen the public health care Albertans rely on. We would restart the government's relationship with healthcare professionals and make sure they have the resources they need at the front line. Thank you, and I'm happy to take your questions.
Start with questions in person and move to the line. Any questions in person?
Mr. Shepherd, what do you make of the fact that some of the largest wait times that we're seeing is right behind us in Alberta Children's Hospital?
It's deeply troubling that we are seeing these extreme wait times here at the Alberta Children's Hospital. We've certainly been hearing from parents who have been waiting here with their kids. Just got an email at my office yesterday from a father who was here with his son, afraid he had a broken arm, was looking at the clock and seeing a predicted wait time of 10 hours. So that's just simply unacceptable, but it is the result of repeated decisions by this government. The fact that so many Albertans now are without a family doctor means that if they have even a smaller issue, they have nowhere to turn but to come to the emergency room. The removal of counselors and mental health professionals from our schools means that kids that are having a mental health crisis have one less resource they can turn to, and more of them are ending up here at the Alberta Children's Hospital. This is unacceptable and it has to change.
And I should have said that I'm Stephanie Thomas for CTV Calgary. As a follow-up, you know, the UCP government says that it's invested historically more than any other prior government has in healthcare. So what's the gap? What's missing from that money and the lack of service and the wait times and surgical delays?
So let's be clear, the investments made by the UCP still fall short of simply accounting for population growth and inflation, especially with inflation at record levels. So they've really got nothing to brag about there. Secondly, they can talk about historic spending, and again, that's in context, but they are also historic in terms of their war on healthcare workers. We've never had a government that's been as antagonistic towards doctors and driven them out of province, who's tried to grind down the wages of nurses and other healthcare professionals in the midst of a pandemic when they are so desperately needed. So frankly, this government has created this situation, and I will say what I have said many times before, no government has done as much damage to our public health care system in this province as Jason Kenney and the UCP.
Any other questions? Okay. Now move to questions on the line. First question to Jennifer Lee.
I'm not sure if you can hear me. Can
Yes,
you hear me?
I can.
Okay, thanks. Sorry, I'm having trouble hearing the question, so I hope I'm not repeating anything that anyone else has asked. But I guess I'm wondering, you know, we've heard in recent weeks and months from physicians, other frontline healthcare workers, that there's a whole bunch of factors contributing to these extremely long wait times, in particular at the Children's Hospital, including COVID, other viral illnesses, staffing shortages. You referenced the mental health crisis that we're seeing unfold in children. I guess I'm wondering, what are some of the immediate solutions that you're calling for here? Because some of these things, you know, can't be addressed really quickly. So are there some things you're calling for here that could be instituted quickly to address some of these urgent wait times?
So absolutely, I recognize that this is a complex situation we find ourselves in, but we are here at the severe level that we are because of repeated decisions by this government. They have painted us into this corner. They chose to undermine our healthcare system, to go to war with healthcare workers, create this critical staffing shortage. You know, I recognize that many other provinces are dealing with similar situations, but on every front, Jason Kenney and the UCP have made this situation worse. And unfortunately, that means that, yeah, it is difficult to find immediate steps that can be taken. What I can say is one of the biggest things I'm hearing from frontline healthcare workers is the exhaustion and the low morale. And a big part of that comes from the decision of this government to continue to deny this crisis, to continue with, you know, the kinds of problematic negotiations we've seen with them, the fact that they still are holding on to the power to tear up any agreement that they do finally manage to sign with doctors in the province of Alberta on a whim. So I think that's a big part of what we have committed, and certainly if we had the opportunity, if we were in that position, is we would be working on rebuilding that relationship with frontline healthcare workers, and that's really what this government needs to be doing. In terms of, I guess, other steps that could be taken, yeah, we need to create an environment where we are able to recruit folks in and bring them in. That's the only way we're going to get through, I think, the kind of crisis that we're facing right now. We need more folks that are able to work, that are willing to work here in the province of Alberta in the healthcare field, and it's not going to happen with the kind of government that we have now.
Did you have a follow-up, Jennifer?
Yeah, I do. I wanted to touch on the mental health situation there, particularly Alberta Children's. You referenced it we have heard, as I said, from physicians who say they are seeing like an unprecedented number of kids coming in need of mental health help. What are your specific thoughts on what could be done to address that, to relieve some of the pressure that they're seeing there?
So one of the things I referenced, and certainly my colleague Sarah Hoffman has spoken about often, is the need for mental health professionals in our schools. This is something that was undermined and essentially defunded under this government. And that means that when kids are beginning to have struggles with their mental health, they have one less resource they can turn to. And I've spoken with folks working, working in psychiatry in AHS, and they have identified that immediately. Putting more mental health care resources in our schools is an immediate step that this government could be taken that would help relieve some of the stress and the pressure that we are seeing here. Certainly increasing availability of mental health resources in the community. One of the proposals that we put forward during the pandemic was funding 5 publicly funded mental health care sessions for every Albertan under our Alberta Healthcare Insurance Plan. And again, that helps relieve some of the pressure, give people opportunities to get help before they are in crisis and need to depend on the resources in the emergency room.
Any other questions, Jennifer?
I'm good. Thanks so much.
Okay, do you want to work past your questions on the line or in person? And seeing none, that's all for today.
Thank you.
So much for watching, and to learn more, check out albertasfuture.ca.